Hello, Quest employees, and welcome to May's webinar. My name is Michelle Barnes, and I work in the Employee Benefits Department at Andrews O'Neill & Lowe Agency. We work with the Quest Group to administer employee benefits. In this webinar, we'll be discussing skin cancer and Melanoma Awareness Month. As I said, May is National Skin Cancer and Melanoma Awareness Month. Did you know that skin cancer is the most common of all cancer types? There are three types of skin cancer: basal cell, squamous cell, and melanoma. Non-melanoma skin cancer is very common in the U.S., with more than 3 million people diagnosed each year. Basal cell carcinoma and squamous cell carcinoma, which are non-melanoma skin cancers, are the most common types of skin cancer. Non-melanoma skin cancers rarely spread to other parts of the body. Melanoma, on the other hand, is an aggressive form of skin cancer. The American Cancer Society estimates that there will be 91,270 new cases of melanoma this year. As I said, melanoma is an aggressive form of skin cancer. It is more likely to invade nearby tissues and spread to other parts of the body than the more common forms of skin cancer. Although melanoma represents 5% of skin cancers diagnosed in the U.S. each year, it results in more deaths than the other two types. According to estimates made from the National Cancer Institute surveillance, roughly 91,270 Americans will be diagnosed with melanoma, and nearly 9,320 people will die of the disease. So now that you know a little bit more about melanoma, let's discuss some melanoma risk factors. Melanoma is more common in men than women and among individuals of fair complexion. Unusual moles, exposure to natural or artificial sunlight through tanning beds, and a health history can affect the risk of melanoma. In addition to the skin, melanoma may also occur in mucous membranes, thin, moist layers of tissue that cover surfaces such as the lips or eyes. Moles, brown spots, and growths on the skin are usually harmless, but not always. Anyone who has more than 100 moles is at a greater risk for melanoma. The first signs can appear in one or more atypical moles. That's why it's so important to get to know your skin very well and to recognize any changes in moles on your body. Look for the A, B, C, D, E signs of melanoma, and if you have one or more, make an appointment with a physician immediately. A is for asymmetry. Asymmetry is a warning sign for melanoma. A benign mole is usually symmetrical. That is, if you draw a line through it, the two sides will match. B is for border. A benign mole has a smooth, even border, unlike a melanoma. The borders of a melanoma tend to be uneven. The edges may be scalloped or notched. C is for color. Most benign moles are all one color, often a single shade of brown. Having a variety of colors is another warning sign. A number of different shades of brown, tan, or black could appear. A melanoma may also become red, white, or blue. D is for diameter. Benign moles usually have a smaller diameter than malignant ones. Melanomas are usually larger in diameter than the eraser of your pencil, but they may be smaller when first detected. E is for evolving. Common benign moles look the same over time, but be on alert when a mole starts to evolve or change in any way. When a mole is evolving, see a doctor. Any change in size, color, shape, elevation, or another trait, or any other symptom such as bleeding, itching, or crusting points to danger. Seek a professional promptly if you see any changes in moles. So now that you know about the three types of skin cancer, let's discuss risk factors for skin cancer as a whole. Anybody can get skin cancer, but people with certain characteristics are at greater risk. They include people with a lighter natural skin color, skin that burns, freckles, reddens easily, or becomes painful in the sun, people with blue or green eyes, blonde or red hair, people with a large number of moles, a family history of skin cancer, and a personal history of skin cancer. Regardless of whether you have any of the risk factors above, Reducing your exposure to UV rays can help keep your skin healthy and lower your chances of getting skin cancer in the future. Most people get at least some UV exposure from sun when they spend time outdoors. Making sun protection an everyday habit will help you to enjoy the outdoors safely, avoid getting a sunburn, and lower your skin cancer risk. So now let's discuss some sun safety tips. Plan your sun protection using these tips. Seek shade, especially during late morning through mid-afternoon. Wear clothing that covers your arms and legs. Wear a hat with a wide brim that shades your face, head, ears, and neck. Wear sunglasses that block both UVA and UVB rays. Use sunscreen with SPF or higher. And remember to reapply sunscreen at least every 2 hours after swimming, sweating, or toweling off. I will leave you with this. A tan does not indicate good health. A tan is your skin's response to injury because skin cells signal that they have been hurt by UV rays by producing more pigment. Any change in skin color after UV exposure, whether it's a tan or a burn, is a sign of injury, not health. Over time, too much UV exposure can cause skin cancers, including melanoma, basal cell carcinoma, and squamous cell carcinoma. Every time you tan, you increase your risk of getting skin cancer. Again, my name is Michelle Barnes from Andrews O'Neill & Lowe Agency, and I thank you for watching this month's webinar.